Hey, I'm Dr. Josh here, and in this video over the next few minutes, I'm going to really do this breakout session on inflammation. So if you've seen that first video where I kind of went off on the things that age us, right? And so aging's a young person's problem, and we want to decelerate our aging, which is really the whole process of just reducing our disease incidence and improving our health and having vitality and wellness and longevity for as long as we are alive. And the interesting thing, the funny thing is, when I was sitting with a patient once and we were going through what we were going to accomplish and how we were going to help reverse this particular person's diabetes and the risk factors and the complications that he was already facing, and he's like, great, so I'm going to be healthy when I die. And it got us all chuckling, because it's really true that, you know, we want to be well when we die. We don't want to have these years in our life that we're disabled and we can't do things, and we don't have the memory anymore. We don't remember our children, and your grandchildren are like, well, you know, slow down for grandma and grandpa. So we truly want these later years of our life, at least, you know, that's my mission. And the reason why I do this is the later years of my life to be able to keep up and do the things that I want to do and keep my longevity and keep my vitality. And so rounding back on that long-winded segment right there is primarily, number one, what breaks us down, what kills us, is inflammation. And it manifests and it just destroys us. It could destroy us at the cellular level, at the organ level, and at the system level. And so in this video, I want to talk about how we first and foremost understand what inflammation is, the causes to inflammation, the pathways, which I'll show you in little breakouts, and then once we identify it, how do we fix it? So what processes do we use to identify inflammation in our body? And truly, like, this is stepping stone number one, because when we get this, a lot of other processes in our body work well. Because if we look at the body's initial, it's the body's initial healing response, which means that anytime that we damage something, the initial acute inflammatory response is that initial response to ignite the healing process. The immune system that is regulating our body's function is the first thing on the scene, and they want to identify what's wrong, what happened, and that stirs up the inflammation, the swelling, the redness, the heat, the pain, because then the body has to decide how it's going to repair it, which goes into phase 2 and phase 3 of our repair and remodeling. However, if we continue to bombard that initial response, the inflammatory response, the body never has a chance to completely move into phase 2, which is repairing and then ultimately remodeling. So then you get caught in this, what you call subacute phase, and that's what stirs up the problems, because then we start creating cellular defects and cellular dysfunction, and the accumulation of cellular dysfunction creates organ dysfunction or organic dysfunction. And when we have organic or organ dysfunction, that starts to create dysfunction in our system. And anything and everything can happen based on that malfunctioning biochemical response, which we're going to talk about when we talk about the pathways, okay, and what causes that. So that's what's going on initially with inflammation, and then we're going to learn how to control it and how to combat it. So what I'm going to get into now is the causes of inflammation, and so we're going to break that out, and then we'll move into the pathways, and we'll move into the identification of it and the fixing processes of it.